Hello everyone, this is Dr. J and welcome back to the channel. If this is your first time, I appreciate you stopping by and visiting the channel and watching this video. This is a compilation of 3 different patients, and the first one is a young teenager with bilateral ear impaction secondary to or as a result of chronic AIRPOD use. Just adjusting the magnification here for a second, get the right magnification level on the microscope. Now, if you haven't had a chance to go watch my latest video, it's a very large wax plug, and it's a very hairy wax plug. I call it the woolly mammoth wax plug. If you haven't had a chance to check that out, go click that link there and check that out. Back to this kid's ear. This is his right ear, and we are looking just on the inside. And you can see the earwax is relatively soft, but it is still completely blocking that ear canal. And we're just lifting up with the suction to develop a plane or a space between the wax plug and the ear canal wall. And once we were able to just get that up, it was able to rotate out fairly easily. This was not completely filling the ear canal from outside to inside, but it was completely blocking the canal to the point where it's creating some hearing loss. And there you see that first plug comes right out. You can see the concavity there that was caused by the AirPods. And when you wear them that often, it's just going to take the wax that's normally trying to get out, and it's just going to push it back in and creating a plug. And secondarily to that, or because of that, he had some hearing loss. Now, this is his left ear. This side looks a little bit different, and that is because the earwax looks just a little more moist on the surface. And that can happen after a shower. I believe this kid had showered the morning of, and that's pretty normal. The earwax will get a little bit soft when somebody showers. But underneath the surface, underneath the moist wax, was a very hard and dry plug. Again, we're just looking around, we're seeking, we're trying to find a window, and boom, right there. You can see that little triangle window right there in the lower part of the ear canal. And once I see that, that's the window of opportunity. We lift up a little bit more in that area, and then I know I can get some drops or get some air between that wax plug and the ear canal. Once I see that window, I just manipulate it a little bit more in that area, and then, my go-to, I'm going to go to some Colace at this point for a little lubrication. And once I get that in there, we get just enough to where we see it start to slide back and under that wax plug. Just a little more for a little extra help. And then when we go back in, we take the suction and just kind of pump it a little bit. And the goal with that is to, again, get that Colace to surround the plug that provides the lubrication you need, that provides the ability to get the wax plug out in one whole unit. And that way it'll be less traumatic for the patient, less work for the provider, and it just works out great for everybody. And utilizing an alligator forceps here, we just slide this out. Looks like a giant snail almost. You can see there's kind of layer upon layer there. And that's just been built up from years of AirPod or earbud use. I don't know what they call them in the UK, but earbuds or AirPods are just the little speakers that we put inside the ear canal. And acts kind of like a plunger sometimes. If it's exactly the same size as the ear canal, then it's just going to push stuff back in sometimes. The second patient, they had just very dry ear canals, dry wax, dry skin. Usually these can be treated after you remove the obstruction, a topical regimen of some sort of ear product or ear oil. You can get a lot of stuff over the counter. You can get a lot of stuff, and sometimes just the stuff you have at home will work. Johnson & Johnson baby oil, virgin olive oil, or just regular olive oil will work too. The lighter the oil, probably the better it'll be. Mineral oil will work as well. And there you go. We're removing there a little bit of keratinaceous debris or old skin. And once you break through that, then that wax plug is able to move out freely using a right angle hook here. I believe this patient was not fond of using suction, and as dry as it was, probably wouldn't respond too well to the suction. Speaking of oil drops, I don't know if you've seen this yet. On my last video, I promoted a Sensi's natural ear mist. A friend of mine developed this. He worked hard on it. He was able to come up with a recipe that works really well in the ear canal for long-term ear care. It's very safe for the ear, and like the ad says, it's like hand lotion for your ears. Give it a try. Coconut oil, olive oil, vitamin E oil, lots of great stuff for the ear. Use that promo code and give it a try. Here we are back in the left ear. The left ear looks very similar to the right ear. A lot of dry, again, keratinaceous debris, old skin. And then you have in the center of that a wax plug. So we're just trying to loosen up that keratinaceous old skin that's trying to slough out but just can't get out. And it seems like the entrance to the ear canal, some people might call it the introitus, or it's like a bottleneck. The ear canal itself is wider than the entrance to the ear canal. And because of that bottleneck, and that's where the skin happens, and that's where your ear canal is going to be the driest because it's mostly exposed to the outside elements. That's where it's going to pile up and become obstructed. This patient will do well, again, on those drops, those Sensi's ear drops, which are specifically designed for long-term ear care. You can use them daily or once a week or twice a month or once a month, and you just vary that regimen based on whatever the patient might need. Not every patient's going to have the same exact regimen that's required to keep their ears healthy and to keep them from backing up and plugging up. So we just kind of tailor it to the patient. Dare I say, play it by ear, if that works. Sometimes you wind up pulling a few ear hairs here when you're trying to get the rest of this debris off. I warn the patients ahead of time. I was like, you might feel this a little bit. Sometimes the ear hairs will come out too there. Just getting the front way clear here, the front of the ear canal. And you could see there it was a nice, totally clean ear canal, and the eardrum looked perfect. This next patient is just the left ear. The right side did not need a large, extensive debridement, but the left side did. This patient, once we start moving the plug, especially towards the end here, you'll see I kind of slowed down the video to show you the plug. I was trying to demonstrate how large the plug was, and the patient had a pretty severe cough reflex, the Arnold's nerve reflex, or the auricular branch of the vagus nerve reflex, where if you agitate the ear canal or touch it ever so slightly, then it will create a feather-like sensation in the back of the throat. It can lead to coughing and even gagging. I've had some of the viewers here say that they actually will even puke and start gagging real hard when their ear canals get manipulated. Here's the plug coming out, the big plug, and right about here is when they start to cough. Again, Arnold's nerve, cough reflex. I slowed it down here just to show you how dramatic the movement is sometimes. It can be a little dangerous if you're in the ear canal when they start coughing like that. You have to just stop the procedure. And luckily, though, that it came out in one piece, and it didn't require us to have to go back and do any further debridement. The ear canal was clear, as you see here. I hope you enjoyed those 3 patient scenarios. Thanks for watching, and thanks for all the positive comments. Have a great day.